King Charles announces his cancer treatment will be reduced in rare health update. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years, the monarch said. King Charles is sharing a rare and hopeful update about his ongoing cancer treatment in a new televised message. On December 12, the King, 77, appeared in Channel 4's Stand Up to Cancer broadcast with a pre-recorded message filmed at Clarence House several weeks ago. Speaking candidly about his own overwhelming diagnosis, the importance of early detection, and the reality that millions of people in the UK are missing out on potentially life-saving screenings. But he also revealed a significant development in his own health journey. Today I am able to share with you the good news that thanks to early diagnosis, effective intervention and adherence to doctors' orders, my own schedule of cancer treatment can be reduced in the new year, the King said. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years. Testimony that I hope may give encouragement to the 50% of us who will be diagnosed with the illness at some point in our lives, he continued. While avoiding the word remission, a Buckingham Palace spokesperson confirmed that the King's recovery has reached a notably positive stage. The monarch is understood to have been receiving weekly treatment since announcing his undisclosed cancer diagnosis in February 2024. His Majesty has responded exceptionally well to treatment, and his doctors advise that ongoing measures will now move into a precautionary phase, the spokesperson said. This position will be continuously monitored and reviewed to protect and prioritize his continued recovery. People understands that while the specifics of the King's treatment will remain private, the frequency will be significantly reduced. The exact type of cancer will also remain private. The advice from cancer experts is that, in his determination to support the whole cancer community, it is preferable that His Majesty does not address his own specific condition, but rather speaks to those affected by all forms of the disease, the spokesperson continued. Charles opened his remarks by acknowledging how profoundly a diagnosis can upend a life. I know from my own experience that a cancer diagnosis can feel overwhelming. He went on to describe what he called a nationwide community of care, surrounding patients, from specialists to nurses to volunteers, and emphasized how crucial early detection is to improving survival. Early diagnosis quite simply saves lives, he said, pointing to stark statistics. When bowel cancer is caught at its earliest stage, about 9 in 10 people survive at least 5 years. A number that drops to just 1 in 10 when detected late. A statistic that troubles him deeply, he added, is that 9 million people in the UK are currently not up to date with their recommended screenings, representing 9 million opportunities for early diagnosis being missed. I know, too, what a difference it has made in my own case, enabling me to continue leading a full and active life, even while undergoing treatment, he continued. To help close that gap, Charles highlighted a new national screening checker tool designed to demystify the process and guide people through eligibility for breast, bowel and cervical cancer screenings. Compassion must be paired with action, he said, urging viewers to make screening part of their New Year's resolutions. Your life, or the life of someone you love, may depend upon it. Buckingham Palace previously confirmed to People that the king had recorded the video message at his London home, where he reflected on the journey that began when the palace announced his cancer diagnosis in February 2024. The news came shortly after he underwent treatment for a benign enlarged prostate. Officials clarified the cancer was unrelated. The monarch reduced his royal duties for 3 months and returned to work in April 2024 with a visit to a major cancer hospital in London, where he was announced as patron of Cancer Research UK. On December 12, the Buckingham Palace spokesperson said of the monarch's work schedule, "The king has taken great comfort and encouragement from being able to continue leading a full and active life throughout his treatment, while always heeding the advice of his medical team. His ability to uphold all of his state duties, and to continue with public engagements and overseas tours, has helped greatly with the positive mindset that, as many families will know, is such a vital part of the recovery journey," the spokesperson continued. King Charles has also been open about his experience with cancer in conversation with fellow patients he has met through his royal work. In March, he was briefly hospitalized following an adverse reaction to his routine treatment for cancer. A royal source described it as the most minor bump in the road that's very much heading in the right direction. Following his visit to Canada in May 2025, palace aides gave an update on how the king was living with the disease. "Like millions of other people around the world. The thing you learn about this illness is that you just manage it, and that's what he does," one said then. "Medical science has made incredible advances, and I genuinely see no difference in him," they continued. "As long as you just do what the doctors say, just live your life as normal as possible. That's exactly what he is doing." King Charles' short film was broadcast as part of Channel 4 and Cancer Research UK's Stand Up to Cancer campaign, which works to raise awareness and funds for cancer treatment and life-saving research. In March 2024, his daughter-in-law, Kate Middleton, announced that she was undergoing treatment for an undisclosed form of cancer. The Princess of Wales, 43, said that September that she completed chemotherapy and announced in January that she is in remission.